Everybody. It's so great to be here with all of you. As Stephanie mentioned, this is our fourth and final site visit presentation. And today we've got with us Manos Abiertas, which is another amazing organization working in the space of reproductive health and direct service throughout Guatemala. So as usual, the structure of the presentation is going to be as follows. I'm going to give a brief introduction into Manos Abiertas as an organization, then contextualize their work within the broader sort of state of healthcare in Guatemala. And then I'm going to recount my experience talking with the midwives and Diana in Guatemala. With quotes and pictures and just a broad kind of analysis of the work they're doing and why. And then I'm going to kick it over to Diana, who's going to speak in much more depth about the organization, the types of work they do, why, and what they're looking forward to. So again, as Stephanie mentioned, we will have a Q&A period. If any of you are interested in learning more, we've got Diana with us here live. So feel free to jot down any questions and we will get to as many questions and answers as possible in the Q&A period. Okay, so Manos Abiertas is a women-led, community-based organization in Guatemala that works to provide comprehensive reproductive health care, and in particular, autonomous midwifery care. So really offering an alternative approach to childbearing throughout Guatemala. They also work to provide culturally competent education and holistic healthcare services in ways that work to empower women, Guatemalan women, especially those in vulnerable situations without broader access to care or information or education or services in the space of reproductive health. So in terms of my site visit, I spent about 2 days with Manos Abiertas and the team. I went first to Ciudad Vieja, which is a small kind of community, a little suburb right outside of Antigua, Guatemala, which is the bigger colonial town I've talked about and kind of used as my home base for all of these site visits. So I met with the Manos Abiertas team in Ciudad Vieja the first day, got to speak with them, meet at the headquarters, and learn a little bit more about the work that is being done by the midwives there. And then I traveled back to Antigua and had a great conversation over the course of a few hours with Diana in Antigua in a park in the center of the city, just talking about reproductive health and family planning and Manos Abiertas and the work being done there. So in all cases, I was just really, as usual, very inspired by the work being done by this organization and by the level of passion and integrity and competence that I saw from all of the employees working at Manos Abiertas and, of course, from Diana, the executive director. And so over the course of the past couple sessions, we've been talking about the kind of situation in terms of healthcare in Guatemala, the disparities that exist in terms of access, the challenges that Guatemala faces in terms of receiving and properly disseminating equal access to comprehensive care. And one theme that I wanted to introduce today to kind of underpin our conversations is the theme of obstetric violence, which is a theme that came up in conversations that I had with the midwives, and something of real import as we kind of work to really understand the foundations of a lot of the inequalities that we're seeing play out in terms of healthcare throughout the region. So obstetric violence is defined as the mistreatment or neglect or discrimination or abuse of someone during pregnancy or childbirth or the postpartum period by healthcare providers. This is a term that actually originated in Latin America, I think first Venezuela, then Mexico, and then spread throughout the region. And really, again, kind of helps provide context into, the ways in which people are receiving care and why there is such a lack in terms of access, not only access, but, the ways in which people are treated during things like childbearing and just, more broadly receiving care. So it can manifest in many different ways. There's things like physical abuse or verbal abuse, also the practice of ignoring or refusing consent for things like procedures or even the dissemination of pain medications whenever they're needed. This can also manifest in the form of neglect, which can, relate to delayed or missing care or a lack of privacy or an overall just inadequate provision of resources. And then ultimately also, and this is something that we've kind of spoken to indirectly, just the denial of reproductive autonomy. So the pressure regarding childbirth and the preference that the medical system has on giving birth, despite what the implications may be. So again, in terms of kind of contextualizing this within the broader scheme of healthcare in Guatemala, we can see it play out in many ways, right? And we were talking last time in our discussion with Wings about the prevalence of sexual violence throughout Guatemala and how that leads to forced pregnancy. And we can see that between 2018 and 2024, about 15,000 births in girls aged 10 to 14 were registered, right? So this very clearly speaks to a level of coercion. It's very dangerous to give birth at this age. And these girls are probably pregnant in the first place because of some type of violence inflicted upon them. And also the more broad, like restrictive abortion laws, which disallow people from accessing abortions except in very extreme cases. With that, we've got the broad sort of kind of cultural norms surrounding patriarchy, surrounding machismo culture and influence, which place a very clear sort of hierarchical view of people. Men are placed in a higher position of power and authority and worth relative to women, and this manifests in terms of and is reflected in how people are able to receive care, right? So looking at how this is sort of embedded within the cultural systems of mainstream healthcare and results in things like the denial of services, an overall lack of information, and ultimately stigma, right? So looking at the kind of culture surrounding, women receiving care and how women and girls can often face things like blame or judgment for being sexually active, and just all of the kind of different challenges that are culturally very much a part of, the barriers and the challenges related to healthcare. Also, again, it kind of speaks and provides context into some of the themes we were talking about before that Guatemala as a whole experiences in terms of maternal health outcomes, being very low and disproportionately worse amongst indigenous groups, and an overall limited access to contraceptives and family planning services. Just looking at this within the lens of the broader culture, which has a certain level of violence that in mainstream healthcare is placed upon women. And in my conversations, as I said, with the midwives, they were very open about this and really interested in talking about this as a concept and a theme because it is so pervasive in their work and something that they believe acts as a real barrier to, better access to care. So this is my conversation with Miriam, who's a student midwife, and she was talking about her own experience with her sister, who directly was a victim of obstetric violence. And she was talking about how whenever her sister got to the hospital, she was not treated with respect or care, right? She knew what was going on with her body. She knew that she needed urgent care. She requested a female doctor and was denied that request, and also just ignored in terms of, her expressing the urgency of the care that she was needing in that moment. And the result of that is that she ended up, having her baby in the waiting room, right? And Miriam says, like, this is a direct consequence of the broader culture surrounding healthcare here, which is that, because she was a woman, no one believed her and no one helped her. In my conversations with Diana, we were able to do a really deep dive into the broader sort of cultural norms surrounding obstetric violence and how it manifests in terms of healthcare, not only in terms of how people are treated by the healthcare system, but also how women have embodied this kind of understanding of themselves as being inferior, right? And, not having the confidence or the wherewithal or the education or the resources to really learn about their bodies or to really feel empowered to ask questions, right? And so, just speaking into kind of the broader culture around this, which has resulted in a distance, between ourselves and our understandings of ourselves and, the needs that we can express. And this is something that, yes, is a real challenge in Guatemala, but I think is worldwide, right? In terms of access to care and our own connections to our bodies as women living in these various forms of patriarchal societies. So she says, women have been conditioned and trained from very, very early on that they are not entitled to opinions about their bodies. They're not allowed to ask questions about their health. They're not encouraged to learn about their bodies. And so the consequence of this is that we give power of our bodies and our health and our autonomy to whatever male seems like the current authority, in this case, the doctors, right? So again, kind of speaking to the broader cultural norms and the implications of machismo and of patriarchal values into our own lived experience. Evelyn, who is a junior midwife, was talking a lot about just the influence of machismo culture, which is a very kind of prevalent recurring theme that we've talked about a lot in all of our site visit presentations, because it is such a big challenge, especially amongst, the more rural and lower income communities. And in terms of family planning, she was saying not only that men just feel and are superior, in these sort of more patriarchal paradigms, but that in terms of family planning, men are often against family planning and birth control because they want kids, right? So they believe that we should have as many children as God, quote unquote, wants, right? Again, kind of speaking to the cultural values that are inflicted upon women and the pressure that women experience to fulfill certain roles in their families and in their communities, related specifically to childbearing from really young ages into adulthood, to the exclusion of pretty much anything else. And yeah, kind of how that is detrimental ultimately to, of course, reproductive autonomy. Maria, who was a senior midwife, was talking just a lot about the experiences she has in terms of, the patients that she's seeing, and speaking into why she believes there is such a heavy prevalence of child marriage and children giving birth. And she said that there's different reasons for this, and ultimately it relates back to lack of access to resources, right? And just the broader culture of abuse, right? She's like, there's different reasons why girls are getting pregnant, either because they're being abused or because they don't have access to family planning. And so they ultimately also don't have the information necessary to even know that they can prevent unwanted pregnancies, right? In contrast, whenever women have access to family planning, they're more empowered, right? So, and they ultimately gain better access to physical and mental health, and can become more stable economically. So this is something that is very well known amongst the organization, and I think amongst healthcare professionals more broadly, but something that Manos Abiertas is specifically working towards is to address this unmet needs through providing more patient-centered, holistic care. Which is a tenet of midwifery, right? And I'm sure Diana is going to speak in much more depth about this, but their approach is to really value the patient, to really kind of center the patient and their experience in the process of childbearing and the process of receiving healthcare, right? In a way that's completely different than what the mainstream healthcare system has provided and offered, and in a way that is recentering the power and the discussion to be centered on women and their experience and their knowledge, right? Reconnecting women with this process and with their own health. And so Manos Abiertas is an organization that does such great and important work in this space. They're working to expand access to natural birthing methods, and therefore also offering an important alternative, an alternative approach to childbirth that's rooted in compassion and holistic care, recognizing again that mainstream healthcare systems are not always providing this level of care, and in many ways can be directly, indirectly, overtly contributing to some level of violence against women. And this is my last slide, and I just wanted to include a quote, and hopefully it's a good segue into what Diana will be discussing. But she was just talking about the process of midwifery, and how again it's very much centered around the experience of the woman, and working to create a better and more comfortable and safer environment for them during the process of childbearing. Knowing that, as she says in midwifery, they say, what got the baby in is what is going to get the baby out. And that's oxytocin, that's love, that's intimacy, that's comfortable spaces, that's being able to move and so on. So again, really working to create this sort of more comfortable ecosystem in the space of childbearing and healthcare overall. And with that, I will turn it over to Diana. Thank you very much, and we'll see you in the Q&A.
Hi, everyone. Well, it's always very nice to talk to you, Hannah. And I even got goosebumps just looking at the quotes from the team. They're great. It seems like it was a very productive set of interviews. I wanted to add something that I think is very important on the slide on obstetric violence, and something that is perhaps not yet put out this way in the definition, but the interventions that are given to women needlessly is also a way of obstetric violence. So it's not just the refusal of care, but it's the being obligated to go through interventions, especially when it's not necessary. That is a big part of it. Especially from the lens of midwifery, that's something, we protect the process that is on its own, like natural and naturally occurring. We don't need to intervene, yet it is routinely intervened. So that is one thing. And I would go as far as to say that removing the figure of midwives in any medical system or societal system is also a form of obstetric violence. When you remove the options from women, I would consider that violence as well. So just to add that on top. So I have a presentation. I have a couple of slides, and I'm gonna put them here. So what should work? Let's see. I don't want to say over again what you've already covered, but I'll go through them a little quick, and that will leave more space for discussion if you want, because we love to talk to each other. So, yeah, as you mentioned, this is our mission statement. So AMA is a women-led community-based organization dedicated to advancing autonomous midwifery care and defending sexual and reproductive rights. We provide culturally competent education and holistic healthcare services to empower Guatemalan women, particularly those in vulnerable situations. You mentioned that already. And why autonomous midwives? Well, autonomous midwives are guardians of ancestral knowledge. We are self-taught and community-rooted. So we get all of our knowledge passed down from midwife to midwife, and that is essential to our care. We accompany each woman as a complex and unique being, grounding our practice in scientific evidence while adopting international standards to our land and context, because even the international midwifery standards don't necessarily apply or are respectful to our context. And also in obstetric violence, not allowing women to have their ancestral practices is another way of violence. If you're not allowed to birth at home, if you're not allowed to have the community midwife with you during the delivery, and that's what it is, the practice in your community, that is also a form of violence. If you are denied the access to, say, plant medicine, if you're not allowed to move around, all of these things are also obstetric violence. Yeah, so we do not work for the health system. We defend the right to define our own profession, preserve the autonomy of midwifery, and build a model that allows women to make informed choices. And that goes from choosing who their care provider is to whether they want to have a baby or they don't. So to give you a general context, although you have already gone in this a little bit, but I framed it on a more general context. So Guatemala has a very fragile democracy. From the outside, we look like one of the most democratic countries. But yeah, Guatemala's institutions remain weakened by corruption and inequality, obviously the consequences of which are always the bearer of them, the women, right? The lower income women, indigenous women, younger women. So despite the 2024 transition that we had with the new president, reform efforts are stalled by entrenched political interests. So essentially, our new government is unable to support the causes it stands for, and they're essentially not doing anything. The more conservative side is kind of just waiting it out until this period is done, so next government can take action in that direction. So we are a little concerned for the next government. So in Guatemala, abortion is criminalized, contraception access is restricted, and misinformation replaces education, which is systematically denying women and girls to their right to bodily autonomy. Midwifery is in a legal limbo, especially for us because we're not traditional midwives, which are recognized by the government, yet their practice is severely restricted, and they are also enduring a lot of systemic violence. And it excludes autonomous midwifery, so us, and professionally trained midwives as well. So that leaves modern and rights-based midwifery without any legal standing or protection. And then, working in the non-for-profit sector, we can see that the support for sexual and reproductive health and rights is shrinking worldwide. Major donors have pulled back and leaving grassroots organizations to survive with less than 2% of global philanthropy. Also, if you want to ask anything in between the slides, please feel free to. I think it's better that way. So yeah, still in this hostile landscape, AMA, Manos Abiertas, remains committed to providing high-quality community-centered care with integrity and adaptability and a focus on women's health and well-being. We're building legal resilience, we're diversifying our funding and defending the right to safe, dignified, and feminist care. We believe at our core that midwifery is resistance, not disappearing, not allowing the profession to disappear is, the way we do our part for this country. So we have 3 core programs. The first one would be comprehensive midwifery care, which is on-site, so as you said, on the headquarters, where people come to receive care, and in mobile clinics. So we have a vehicle that can travel to different spaces to provide care as well. We offer, routine GYN care, perinatal and childbirth care, family planning, and everything is grounded in human rights, centered on women, and guided by the philosophy of autonomous midwifery. Another one of our programs is a community education and on health and sexual and reproductive rights. So this is a new program. So we're doing a pilot this year on 4 different types of workshops. And these are for girls, for older women, for caregivers and also for people with disabilities, and they are on menstruation, violence prevention, family planning, healthy living, all with a focus on sexual and reproductive rights. And the community has been loving it. Everybody wants us to keep coming back. And then our third program is a reproductive justice program. This is not very outwardly towards the community. This is work we do with other organizations. So essentially, we're trying to protect every woman's autonomy and sovereignty to decide over her body, over her maternity, while recognizing and addressing the inequalities that limit that freedom. We do this through supporting a network of organizations, individuals who guarantee access to safe care. We work on a scale donation model that adapts to women's situation while supporting our sustainability, which means we do ask for a small fee from the community per service, but we won't deny anybody care. So if someone can't pay, they don't. But if someone can pay, they will. And people who fall outside the scope or like the population goal of our organization would contribute a little more so we can, sustain our operations and not rely totally on international development efforts. So why do we do these? We do these because we believe that sexuality, reproduction, birth, and motherhood are unique experiences that shape the future of every woman and of our society. We leave out our feminist and intersectional justice. which means we defend women's rights, confront and seek to repair the injustices they face within health systems. And this is a very big part of why we do it, because we've seen women having terrible care, violent care, and ended up in really bad situations. So we're trying to improve the health of women, but also their overall well-being. And naturally, we reject all forms of discrimination or medical violence. So every action, every consultation, workshop, and alliance strengthens women, ensures the sustainability of our organization, and weaves a fabric of collaboration that leaves a profound and lasting impact on their lives in Guatemala and also on our planet. And my presentation was way shorter than I thought it was going to be, but that's great because now I can talk more. So,
Yeah, thank you so much. Great presentation. I'd love if you could go back on some of the slides. You had some really great quotes. Yeah, back one more or that one. Yeah, I wanted to read that quote just more thoroughly because I think it speaks to the kind of foundation of this work, the belief that sexuality, reproduction, birth, and motherhood are unique experiences that shape the future of every woman in our society. Could you speak a little bit more into that and what it means and why it is so fundamental, and then also perhaps why you believe this has not been the case and this is not the case in mainstream healthcare systems for the most part. And we're painting with a broad brush here. Like, of course, there are, I think, really good medical professionals that work within this broader system that we can recognize as being the ultimate issue. It's not the individual, it's the system, right? But yeah, could you speak a little bit more into this quote and what it means for you?
well, I guess there are many layers to these, but medical care is just as colonized as everything else, which means there is something that is taking control over the original experience, right? So sexuality, reproduction, birth, and motherhood themselves are core experiences of women's lives or people's lives, and also what shapes society. So when we remove the empowerment and the autonomy of these processes, and also their respect for these processes, we end up with a society that does not take care of women, does not take care of children, and in turn doesn't take care of of society itself, and also doesn't take care of the environment we live in. So everything's really connected, as we know, right? Population connection makes these connection between reproductive justice and on social justice, and also the impact on the environment. So this is exactly it. The way we treat our women is the way we treat the planet. Yeah.
Yeah, so in our discussions in Guatemala, you were talking about how midwifery is viewed not as like a sort of linear process, but more as an ecosystem. And you just spoke also about how, protecting the health of people and of women is directly implicated in the ways in which we treat our planet. And I'm wondering if you could just speak a little bit more into that. Like, what does it mean to say that the way that we treat women is a direct reflection of the way that we treat our planet?
Again, many layers, but to keep it not so extensive, I guess it's these belief of women being here just to produce more children to support the workforce is the way we see the environment as well. We exploit it and we do the same thing to women. So along those lines, and also I guess the lack of care and respect and the thoughtless way we go about these things, and how we've tried to institutionalize medical care, birth, all of these things. It's the same with nature. It's not inherently an industry, yet we've made it so. And we're seeing the consequences of that every single day in people's health and the environment and everything.
hmm Yeah,
Yeah.
it's kind of the premise that we see in like conversations about justice, environmental justice, climate justice, is that the same systems of oppression that have caused like large scale environmental destruction and ecological collapse are the same systems of oppression that have and continue to subjugate people, marginalized populations, exploit people, right? So really creating a way forward that's truly combating, in a fundamental sense, the issues we're facing, which are very multifaceted and totally entrenched into pretty much all of our social, economic, and environmental systems. Yeah, that's
Yeah,
very powerful. Mhm.
absolutely. Yeah. And also like, the way in general we see progress is defined by the North, by colonizer countries. It's not viewed through the lens of the global South, which does things very differently, including the way we see education, the way we see, natural processes, birth, how we take care of our land, how we take care of our families, how we take care of the community, and even society. It even translates into politics and like democracy and just the way indigenous or local communities handle all these things are very different. Yet it's not seen as progress or as developed if it's not done by the rules of the North.
Mhm.
So yeah, kind of just trying to return the power back to the community and to the women.
Right. And related to that, you were talking about how midwifery is in legal limbo and that,
Yeah.
and the difference between traditional midwives and autonomous midwives. Could you speak a little bit more into that? So why is midwifery in legal limbo, and what is the difference between traditional midwives and autonomous midwives? And why is there a stigma against the latter?
Well, I wouldn't per se call it a stigma against the latter. It's more like, okay, let me see where I start with this. So, depending on what part of the world you are at, you'll get a different answer as to what a midwife is and what types of midwives there are. Even within the US, every state has a different definition for it. And here we have what we call traditional midwives or comadronas, who have, yes, gotten their education from a previous midwife or mentor and through, the community and the work and the experience. But they don't necessarily work with modern medicine nor with like international standards of care. Then you have the other end of the spectrum, which would be what we call midwives, which are midwives who have been put through a system and come out the other end, very medicalized, and perhaps lacking that community connection. And they don't learn in a mentor style way. We believe midwifery is something that you learn through apprenticeship and is very much a hands-on training. Um, we believe that these two systems should not fight at all. We believe they're totally compatible as long as someone is from the community, understands the community, and can do that process of adapting the standards into the context. Because I say, yes, we practice according to scientific evidence, but the reality is a lot of this scientific evidence is also biased, and it's also seen through these lens of industrialization and how we see, the healthcare being better. When we think of a woman giving birth at home or using herbs instead of, say, Western medication, we would think of that as old fashioned and inefficient. Well, it works very well in our context. Yeah.
Mhm.
So on the legal standing specifically, yeah, so autonomous midwives per se are not recognized. um, the only thing in Guatemala that protects midwives in general is with the signing of the peace, midwives were recognized as existing, but there is no real regulation around it. And when you have a system that regulates midwives that are not midwives, who don't understand midwifery, who are not in the community but are on government, desks, it's really hard to do it right. Because you don't really know what you're regulating, and that complicates things. Yeah, and it's also there is like a systematic genocide of midwifery in this country, but also in general in Latin America, I would say, and even globally, because there has been these change of narratives that the government has been pushing for over 10 years, which is that midwives aren't safe, that home birth is for the poor, that the safest place to give birth is the hospital, when we have evidence, statistical evidence that shows contrary to that. So yeah, there is not really any type of legal standing for midwives. And there are less and less midwives, not only in Guatemala, but in the world. And I'm scared what that means for women.
Yeah, well, at least you all are doing such important work in Guatemala and really, returning this practice and this concept to, mainstream healthcare or alternative healthcare systems that are hopefully ultimately going to become mainstream. In terms of going back to obstetric violence and kind of speaking about what you were just talking about indirectly, you were talking about how there are forced interventions that are also a form of obstetric violence that is not necessarily as well recognized. What do you mean by forced interventions in this way?
Well, again, starting just from the premise that there is this idea being sold to women that if you're pregnant, you have to go to a hospital when pregnancy is definitely not a medical issue, but more of a normal process of life. That's where it starts. Women being told they need to, I don't know, there's so many interventions, but let me pinpoint some. So, for example, get an ultrasound every single month when it gives no relevant information for the healthcare itself. And we so far don't know what ultrasounds really do to the process and to the pregnancy. Like nobody really understands what the consequences could be. Um, for example, the routine use of certain medications in with the idea of preventing other complications which aren't that common. For example, it's a very common practice, especially and recommended by the World Health Organization, that every woman um, birthing gets a shot of oxytocin, synthetic oxytocin, after the baby's born, before the placenta is born, to prevent postpartum hemorrhage, which yes, is a real risk. It's also seeing not seeing the woman, but seeing the whole lot of women as the same thing. You when it comes to healthcare and it comes specifically to these very important moments in life, you cannot see women as numbers. You have to see their case, you have to know them, you need to know what their risk factors are. And we're slowly seeing the consequences of just generalizing medicine. You can't do that. When you intervene in these ways without having real evidence of what the long-term consequences are, you are affecting generations of women and babies being born. Yeah, we now know that the use of oxytocin can prevent this establishing of nursing. It can, or it's linked to postpartum depression. And like, who cares, right? Because it's just a woman's experience. But that's the reality. They're like looking at numbers, they're not looking at the individual's experience, which is important. It's not just about having a live mother and a live baby at the end. When you think that the most common cause of death in the first year after birth of women is suicide,
Well,
you know? Yeah.
mhm.
The way things happen is also important. The outcome is not only to have a healthy or not dead mother and a not dead baby, you know?
Right. That should be the bare
Sorry, it's
minimum.
intense.
Yeah. And I was thinking whenever I asked that question about our discussion on C-sections and how that
Mm.
might also be a form of forced intervention and sort of a preference uh, that exists within, mainstream like public hospitals to perhaps perform or schedule C-sections. For various reasons, maybe because they're more cost or time effective, or I don't know. Could you speak into that a little bit? Because I know that's a important aspect of the work you're doing in terms of offering an alternative to that.
Yeah, so there is a global epidemic of C-sections in Guatemala, specifically in the private sector. So when you pay for care, usually for a lot of money, it's about 95% of women who deliver via C-section, which means out of 100, only five are delivering vaginally, not even naturally. Um, and in the public health sector, it's about 65%, which is still very high considering that most of these women who have these major surgery go back to homes where there's often no running water. There are other five kids to take care of. The husband's probably not going to help out because he has to go work. It's just not considering the individual again. It's not focused on the woman, it's not centered on the woman. And C-sections, though we're very happy they exist, they're life-saving, absolutely. There is a place and a time for them. It should definitely not be the norm as to how we birth our babies. The problem now, like if you would have asked me these 10 years ago, it would be different. Now is there is a general thought that it's the better way, the easy way, the painless way, but we're completely ignoring that these are processes that we're meant to go through, and they have lasting impacts in the way we mother our babies and the way we mother ourselves. Um, yeah, the body wants to birth. That's just how it works. And yes, sometimes it's not possible. And there are also emotional and spiritual processes that need to be undergone, I guess, um, to recover from a C-section, you know? There are lasting impacts. Perhaps we don't see major complications physically in talking with generations, but for example, one very clear one is the impact in the microbiome of babies and how that has changed generations and how we are sicker now because there are a lot of generations now who didn't get exposed to the bacteria of the mother, which would later prevent disease and also metabolic issues later on in life. Yeah.
Yeah, thank you. All just such important discussions that I think are not really that they're not really necessarily being had, and they're not. My conversations with you and learning more about the work that you're doing is, some of the first times that I've been kind of exposed to this information because I think it's so ingrained in us culturally that there's one way to give birth, and it's all very systematized and safe, and we shouldn't question it, right? But um, I was wondering if you could talk just related to that about, what ways that mainstream healthcare and the process of childbirth, in terms of the environment and in terms of the experience of the woman, might be, not necessarily favorable to a peaceful experience, and then contrast that with the environment that you all as midwives in Manos Abiertas work to cultivate. Like, what is the difference, and why is that important?
Mm, okay, so Guatemala specific and yeah, so I guess one of the primary things is that there is no expectation of being or preparing for an important moment when it comes to childbirth. So it's just, you're pregnant, you have your due date, around that due date, you're going to have your baby, you do what your doctor says, you go into the hospital. Either, more often than not, they'll give you some sort of reason why you should probably have a C-section. Very sadly, very often it is made up, which I know is a big accusation, but that is the reality. Um, and then, like a very well-oiled machine, women are coming out of the hospital with babies in their arms, right? Without even thinking about what happens in there. Here in the public system, for example, the woman goes into labor, the family takes her to the hospital. She's not allowed to have her phone. Nobody knows anything about her or the baby until perhaps a day or two later when they're released off the hospital. What happened in there, nobody knows, nobody cares. If you don't see it, it's not happening, right? Just starting with that, the fact that we have no exposure to childbirth, what it entails, what it looks like, what it can look like. um yeah, that is a main difference. And when you're in there, like we already know, there it's called the avalanche of intervention, which is when you step one foot into the hospital, you get plugged up to monitors, you get IVs, you get, because you have all these things on you, you can't stand up, you have to be laying in a bed. It's hard to manage pain where when you're laying in a bed, so they give you an epidural, which causes a bunch of other complications, which in turn ends up with you being rushed to an emergency C-section because baby wasn't coping with all the things they were doing to you rather than to birth itself. And then you're separated from your baby. Your baby is taken away to a separate room, even though you being in the world has never been anywhere but inside you. And now it's with a bunch of nurses this baby doesn't know and who doesn't know him. And being washed off these very important microbiome. And then eventually you get these bundled up baby. And there is a big sense of that's the best way, that's the healthy way, that is the industrial way, of delivering babies. While on our end, it looks a lot messier, a lot, a lot more centered in the experience itself. So first of all, we like our families to be involved if at all possible. So for the partners to also engage in the process of pregnancy and the preparation for birth. We talk a lot with our clients. We want to make sure they know what to expect, so they know that birth is not an instant thing. And in this rush culture, we expect birth to be, as fast as possible, and that means it's better. But no, having babies, bringing babies into the world takes time, takes effort, it takes sweat and tears, it takes movement, it takes exercise, it takes a lot of effort. And yes, it's hard, but we also want to make sure that people A, know the benefits, and B, know that having a better experience is worthwhile. We're seeing more and more people who come out of an experience like the first one I described, very traumatized, and now for their second pregnancy are looking for something different because they know they would never want to go through something like that again. Obviously, with us, the woman can have her family with her. She can move, she can eat. She's not hooked up to a bunch of monitors. We do monitor as it's necessary, but nothing that prevents the woman from movement, because we know that the women intuitively know what type of movement they should be doing to help this baby out. And there's just such a difference in the manner we talk to our clients, how respectful we are, how we make decisions during the delivery. We make sure they have the information they need and that they are included in the conversation. It's not just something that we choose for them. And obviously, once baby is born, that baby belongs to that family, and we have absolutely no business taking it anywhere. And anything that is done to this baby that is necessary is done in the room on the bed with the families. And yeah, so on. I could talk hours about this, but I know we don't have hours.
No, thank you. That I think sheds a lot of light and important perspective on yeah, the question I was asking, just the difference between a mainstream like healthcare systematic approach to childbearing versus what you all offer. And I know that we've been talking a lot about the process of childbearing and midwifery, but you also, as an organization, offer a wide range of reproductive healthcare services. So women can come to you, as you were saying, like from the time of their first menstruation, right, all the way until after they've given birth, and you can really kind of receive care from you all along that process, right? So there's family planning
Beyond
services,
menopause, yes.
contraceptives. Yeah. Um, and there's a question here just asking about family planning and how it's received. A woman here went to Guatemala a few years ago and recounted that a lot of the women she spoke to were secretive about their use of birth control and family planning methods, and she's wondering if that's still the case.
Yeah, the more rural the area, the harder it is to have conversations around family planning, the more misinformation there is. There is a strong belief in the most rural areas that family planning causes cancer, that it is dangerous, that is abortive. And yes, a lot of the women choose to keep it secret, not necessarily of their husbands, although in many cases, yes, but also of like secret from the families. So there is also a very ingrained macho culture even within the women. So many women don't want their mother-in-law to know, or they don't want the mom to know, because there is this general, especially in the more religious families, that yes, you are meant to deliver as many babies as God sends you, which can be 12 or 13 in a lifespan, right? If you start very early on. So the more urban you go, I think the conversation is becoming more and more open. Also, thanks to organizations like ours, like Wings, the access is a lot more there because the government does not guarantee access to it. So one month they have it, next month they don't. But the conversation around family planning has become a lot more open, and access has become a lot more available, primarily because of the civil sector.
Right.
Yeah. Mhm.
And on a more personal note, there's a question asking just about your trajectory here, your process here, and how Like, how did you come to have, as she says, a caring, sort of repo rights, justice oriented attitude, knowing that you grew up in a culture that is heavily patriarchal, that has machismo influence, and that, is fairly oppressive, at least in a broad sense, towards women?
Yeah, so I didn't mention this on this specific presentation, but Manos Abiertas started 18 years ago and it was funded by my mother. I am half Guatemalan, half German. So yeah, I learned from her and everybody in our staff also, well, not everybody, but most of the people in our staff trained with my mother too. She retired about a year and a half ago, almost 2 years, due to illness, but she had a very extreme feminist view. And we've kind of inherited that and adapted it as well as we can into our context. Um, I guess that's why I see it that way, even though the context I grew up in is not necessarily like that. I was definitely the rebel telling all the kids in school about family planning at like 13, right?
That's amazing. I love that. And it just made me think about, we were talking about kind of the mainstream implications of approaching healthcare in this way and offering this alternative approach to childbearing and also to just reproductive health overall. But I'm wondering, in terms of just like the individuals you're seeing, the families you're seeing, is there often a lot of resistance to the uptake of these methods, or is there a lot of fear surrounding, approaching childbearing in this way, knowing that we have kind of been, I think worldwide, kind of been conditioned to believe that, this more mainstream approach is safer and better, and what is that process like, and how can you educate people about the alternative perspectives and methods available and ways that resonate with them, given this like cultural norm against it?
That is a very complicated question to answer, but we see some very different things. We see people whose families have always delivered at home with the comadrona, people who know that that's just the way you do it, and the trust is already there, which is our favorite kind of to do. Um, because there's not a lot of like brainwashing that needs to be done about fear. Um, we also see a very similar attitude coming from very extreme religious families, which is very interesting. So there is just a general faith in the process of birth and the natural process of it, and just trusting that, this is what we were created for and we are able to do without much intervention. It's more people in the middle who tend to have a harder time with it. So people who perhaps are um, changing the way they live in comparison to their ancestors. So people who perhaps lived in the rural areas before and are now moving into more urban settings, people who also do see progress in the same, north perspective of development, meaning in the industry. Um, and with those families, we often see like a very deep intuition that they know they should not go that way for their birth, but there is certainly a lot of struggle overcoming fear. And also the hardest part, because often families are very secure of their choice, but the hardest part is dealing with society, dealing with their own families who bring in a lot of fear. It's certainly hard. We have some techniques we use. We recommend all our clients don't tell their families their real due date, because otherwise at 36 weeks, everybody starts getting a daily call at 7 a.m. of why isn't this baby out yet? Um, we do offer childbirth classes. We encourage them to have a doula as well, and just inform themselves as much as they can. For some people, this is very reassuring. Some people would rather not have too much information. It is really a case by case scenario, And the other thing is, at this point, after doing this work for a very long time, we we trust the intuition of the family. If this is for them, this is for them. We're not gonna go around forcing people into this. And we also trust the intuition of our midwives. If our midwife thinks that this family is not prepared, we can have that conversation on me of the clients and of the birthing humans. We also, is my internet working? Yeah. Yeah.
Yes.
Yeah. Um, and we also respect the autonomy of the midwives in choosing who they care for. We don't refuse anybody care, but if there are cases that we feel would be better in a hospital settings and perhaps not for medical reasons, we will say that.
Right. And it's more about kind of publicizing the message that there are options in terms of what you want to experience and how you want to give birth, but not necessarily demonizing one thing over the other, but educating people about the options that exist and the potential benefits of going a more natural way. Mhm.
Yeah, but
So,
also remember that the legal standing isn't clear, so we cannot publicly make a lot of noise.
mhm.
It's a tricky setting for sure. That
So
applies to a lot of the work we do.
how do you do outreach? Is it mostly word of mouth?
It is mostly word of mouth. There are other community and autonomous midwives that work, so we recommend clients go to each one depending on where they are. But there aren't that many. The government has been very, very successful at eliminating midwifery.
Mhm. Well, we've got about 1 minute left. I wanted to just ask you in closing, first, if there's anything that you'd like to say to the audience in terms of, how they can learn more about Manos Abiertas or get involved. And then also, if there's time, just what you're looking forward to for this year and beyond.
Well, I have the website here if anybody wants to read a little more about what we do. See, here we go. And just, I guess, keep supporting Population Connection. The philanthropy world right now is a mess. We are very concerned. I saw there was a question there about the impact of US aid not longer being, supportive of the country. And we weren't receiving any grants for them, so we were not directly affected by those cuts. But we do see a lot of organizations that do this work or similar work in our country having to close because they budgeted for some money that was not going to be there, and it wasn't little money, and a lot of other organization or other funders are leaving the region, are leaving Latin America. And although we want to support them, we are a small organization as well, and the consequences are being suffered by the women. So thank you for supporting the work you do in Population Connection. And yeah, pretty much just that.
Yeah, thank you so much. This has been a really interesting presentation to listen to and a really engaging discussion. So thanks as always for your time. Thanks everybody who tuned in, and we will follow up via email with questions that haven't been answered live and any other relevant information. So thanks everybody.